So we're going to put him down on the reformer. What's the first thing we got to worry about?
How close the carriage is to
Getting on. Getting on is the first thing we want to look at, because we've got to make sure that when he lays down, he's not going beyond that 90 degrees, but also that we're not going to put him in a situation where his legs are too close to his chest, right? So the first part is the position. Okay, we have a little block. I'm putting it pretty far out for him because he's pretty tall. He's not the shortest guy either, right? So I'm going to have him come over here, and we kind of went through it the other night. I'm going to actually have him not sit on the carriage. Or if he sits on the carriage, I'm going to make sure that that leg stays extended out. So his right side is his bad side. So what we're going to do is we're going to have him bend this knee and keep this leg just to sit down like this. And then he can bring it in. All right? Be careful again with the internal rotation. You just saw my leg stuck like this. That's not internal rotation, but it's pretty damn close. All right? From here, he's going to scoot down and he's going to put himself on up on the reformer. And we want to make sure it's just like that. All right, let's see you try it. He doesn't follow directions very good, does he? All right, so we're in a good position. B minus? Oh, she's tough on you.
I was a C yesterday, so
I'm telling you. I'm also going to put a head pillow under him because I want to make sure that he's in the most comfortable position for him. Okay? He's not at 90 degrees, so we're safe here. If I go to a toes, he's going to start by coming down, and we'll go to P first. So we'll go into the Pilates first position, and we're going to lengthen on out. So he's going to push on out. I have a regular spring on there for him. Okay? Let's go ahead and come on down. And push on out. And come on down. So already, now we're starting to realize what's going on. Can you see his hips? They're rocking up. It was just like I talked about. So he's already starting to think of peeling his butt off the table as he comes down. So we're going to push on out. He should be able to maintain this pelvis. So we're going to come down, and he's going to drop his butt down. Drop, 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 drop. Hold, push back out. Now I don't want to hit the bottom.
Okay.
All right? So we're going to come down, and we're going to think of dropping the butt. Stop right there. Can you drop your butt this way a little bit? And then come on down. Oh, that's all right. Push on out. Now, he's still having a problem with that. We might need to adjust his body. So with him out like this, I'm going to have him lift his hips up. So go ahead and lift, no, all the way up in the air. Can you lift up and set back down? Just set it back down. Now his pelvis is actually in a better position. Can you guys see that? It's a little bit more level. Drop down, bend in the knees, and drop the butt. Drop your butt. There, he's getting a little bit better. Stop right there and push back out. And come on down.
You can see he hesitates extending the right knee.
Correct.
Just a little more.
He's not going to a full extension. So how are we going to work on that second part? We're first concentrating on the hips. This is the most important part here. All right? Trying to get him to move, push on out. Because even though this hip has been replaced, we still want to work on all the muscles around it. This hip still needs to not need to be replaced. So we want a full range of motion for it also. All right? So bend the knees, come on down, drop in the butt. Can you drop that butt? Keep dropping. And push back out. And come on down.
Because that side's a little longer now, right? You were saying.
Well, there's definitely a difference in size. Push on out.
See, when he extends the left knee, the right knee stays a little bit more bent.
He's also changing it because this foot isn't quite the same also. So you have a difference in foot. He's putting more pressure through this leg going through. So what we're going to do is, again, we're still working on these things until I really get this to drop down. Turn this off for me. Let it drop. There. Right there. Do you see that little nudge right there? Push back out. That's what I want him to get. Now he's good because he knows he's going to let me touch his hips and tell him what to turn off and what not to turn off. Come on down and drop that butt. Drop, release here. Think of that butt just sitting down and push out. You didn't really do it that time. Come on down. So we really need to get that. You can see how he's still tilting up. He's tucking that butt up. So we got to get that down. Okay? So we're going to come down. I'm going to put my hand here, keep the pressure off my hand. Better. Okay? Push. But he pushed into my hand to push out. And come on down. Michelle was talking, she asked last night if I seen those blood pressure cuffs. Sometimes they put a blood pressure cuff underneath them and have you hold on to the gauge to notice if you got pressure going through it. And it's pretty sensitive. You'll be surprised how much you see that little needle pop up and down. But he's doing better though with the hand there. That was actually a pretty good one. Okay, and he's coming down. Now I still want to do the short ones because that's where he's going to feel a little bit of a burn stretch. So from here he's going to stop there and he's going to push halfway out to right about there and then back down. Now he's starting to use those quadriceps. So we're building this strength in this quad right here. And he's getting a nice control. Notice his hips aren't moving as much. He tried to use his abs that time right as I said it. And you could tell it kind of tilted his pelvis a little bit. But we're working more about the stability. So when he does this, we're really working these legs. Can you feel that at all?
It's amazing how it burns.
Okay. Now, push all the way out. We've got his hips better in a better place just by doing this few, you know. Now I'm going to start paying attention to the ankles and the feet. So I'm going to drop his legs underneath to stretch once for me. Sink it, stretch. Yeah, and then he's going to push out on his toes, push out on the toes, and then drop, and push out. Now you guys might not be able to see this, but he's really externally rotating on this leg right here.
I can see it in his knees, even when he drops under, they internally rotate. When he presses out, they externally rotate.
That's kind of what we talk about with the talus. When the talus walks down, the tibia and the fibula rotate up, right? And then when it pushes out, it rotates to the back. So we're talking about those rotations through those legs and stuff. But for me, I want to put a block there. Where's our purple block? Can I borrow that for a second? I'm going to put that right in between. Right there. Now he's going to push out, lengthen out. Now he's going to try to maintain. So we're going to try to maintain that, keeping the heels up, and you're going to bend the knees coming on down. Bend, 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 bend. Keep the heels up. You keep dropping those heels. Lift those heels and push back out. Good. Come on down. Lift, and there you go. That's more in the legs, right?
Oh yeah.
Come on down, lifting. Now, each time you let it go through the ankles, if he left the ankles there, the pressure goes through his ankles in opposition, which is good sometimes, but we're really looking to try to keep the pressure going through his legs into his hips, right? Push out, because we want him to get this idea of stabilizing here. Okay? Lengthen. And out. Reaching with that body. So, I don't want those heels to drop. I want to think of lengthening. Now try to stretch with the back of the head like we did last night. So you're going to think, nope, that's the top, that's the back. Now reach, 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 and then come back down.
Straight those legs are.
And come back down. And lengthen. So I want you to stretch as high as you can get with that, not the, there. Now, again, I don't want the fast action. I just want to think of lengthening. Come on down. And lengthen on out. Stretch it on out. Better, right? Everything looks smooth. Come on down. Drop the butt. Think of drop the butt. Drop it. Drop it this way. Can you drop your hips this way? Like you're pushing your tail into the table?
I'm pushing.
Keep pushing. There. Push on out. Lengthen. And coming. Now this is a coordination deal. It's not actually, he's trying to do this with his top ribs up here. He's trying to hold his arch with the top ribs instead of his lower spine. So we want to lengthen that out. Go ahead and lengthen that out. That tells me later I'm going to do something to try to get some kind of coordination through this area. All right, come on down. And push on out. Excellent. And come on down. Let's do those short ones we were just doing. Let's do a little torture. Push on out, stop, and down. And now you can see some good action happening in those legs. You see the quivers that we're looking for? And then if he drops his butt, it's going to get a little bit better. There's a good one. And he can feel when he does good ones and bad ones. And don't drop that block. Remember, it's $100 every time you drop the block.
I thought it was just about a Magnificat.
Oh, that works too. Talk to me and whine. I'm always good.
Yeah.
Oh. You feel those legs?
It's just, yeah, they're
Push all the way out. Oh. So now I'm going to alternate. So I'm going to bend this knee, drop that leg. Drop, sink that heel. Stretching out those calves. Because even though we were in extension the whole time, we're using all those muscles. So we definitely want to get a good stretch. And lengthen out. And stretch. And stretch. Now he's been working pretty hard, right? Good work. We got to give him a little bit of benefit. Come on down. All the way down. Good. Put your feet up here on my chest. 1 and 2. This traction is nice. Okay? Because it's really going to allow him to allow his spine just to release. He's not used to holding the neutral pelvis, so he's using a lot of those multifidi without even knowing it to try to use it to stretch, and it feels good.
really good.
And it relieves all that compression. His legs look good, everything looks good. Now we're going to go to do the hamstring stretch. We know he's tight, right? We can tell his hamstrings are tight. So we're just going to open them up a little bit. Feel the stretch? Mm-hmm. And all I'm really doing is trying to keep his feet flat. I might have him reach through with the heels. Go ahead and reach the heels to me. There, that does the dorsiflexion and that gets the stretch. I'm also looking not to allow him to push his knees back. A lot of times when people do this, they're going to think of pushing their knees back. Well, we already know he hyperextends his right knee. Okay? So we're going to just think of just allowing the drop. And you can add some nice torture. You can lean from side to side. Just this little rotation in the hips, nice. It's good on the back. I'm making his whole hips rotate. So I'm not just internally rotating the foot, I'm making his whole. Can you see how the hip dropped? One came higher and one went lower. And then the other side. This is all good stuff, and it feels excellent on his back and his ham knees. All right? Now he's going to bend the knees. I'm going to have him almost bridge up a little bit. Now his is a little bit more progressed, where I'm just trying to get a rocking through his low back. I'm not trying to go beyond 90 degrees with that femur, right? But I want to loosen that back up a little bit. And he's using his abs. Can you guys see that? And it's nice. The big thing you don't want to do is push into him. Like I do with my normal clients. I push on those hips and I stretch that out. We're not going to do that. We might do some modifications. We might put a ball under there, which we'll do on the Cadillac a little bit to stretch that out.